Today I will be speaking about the global injustice, HIV/AIDS, with a concentration of looking at it from the country of South Africa. So in South Africa, in 2015, 7 million people were living with HIV, and 19.2% were adults. There are 380,000 new HIV infections and 180,000 AIDS-related deaths. 48% of the adults are on ATV medication, which is the antiretroviral treatment. South Africa is now the country with the highest number of people living with HIV/AIDS, and it is the leading cause of death in the country. And most of the people who have HIV are in the economically productive age group, where they're supporting children or elderly relatives. One of the really interesting statistics, which is from 1992, and that has not changed much, is that the highest rates of infections were actually among late adolescent women and men who were a decade older than them. And I will explain later as we go why that is. So in terms of transmission, HIV is driven largely by a sexual transmission, and one of the other modes of transmission is parenteral transmission, which occurs when people are sharing needles, and this happens between intravenous drug users, which are the IDUs. There is also cases of mother-to-child transmission, which happens in utero, at delivery time, and during breastfeeding. Predominantly affected groups, the highest statistics ranging from men who have sex with men, which are between the 22 and 48%, sex workers and their clients, which are estimated at 59.6%. And remember, in the slide that was a previous slide that I did mention about the highest prevalence in young adolescent women and men who are a decade older than them, this is where they fall in this group. IDUs are estimated at 19.4%, and the number of children and orphans ages 0 to 14 are estimated to be about 360,000. So the history and background of HIV/AIDS. So the evolution of the epidemic during the discovery of diamonds in South Africa, this period ensued a flood of immigrants who moved to work in the mines, and the blacks were only allowed to visit but not stay with their families in the cities. So the social conditions of migrations came about in a way that the black women who worked in the households of white families survived by providing for the sexual needs of the men in the mine compounds, and that started a very widespread beginning of prostitution. The apartheid regime, which is the regime that colonized South Africa, they saw HIV as a problem that was mainly among black or gay people. And the black people started attributing it to an epidemic scare, which they attributed this to the government at the time, and because it was the apartheid government which was colonizing them, they did not trust them at all. So efforts for change, because of lack of trust through the apartheid government, black people thought that it was a way for targeting them and controlling the black community. The first case of HIV infection was reported in 1982. Some of the social issues that are prevalent with this spread of HIV/AIDS are gender inequality, which means that women are often not in a position to negotiate for safe sex, and they are put at risk of infection by husbands and partners. The other thing is migration. Because families are separated, men are separated from their families when they migrate for work, it results to a high level of commercial and casual sex. There is also low levels of financial resources which are available, and that makes decisions about HIV being a priority extremely difficult, and it also limits the general level of health services that are available in the country. Inaccessibility of ATVs, which are the antiretroviral medications, means that majority of the people who are affected by HIV die within 8 to 10 years of infection. So HIV/AIDS affects the health and wealth of households, and the infected individuals are already facing pre-existing poverty, so that tends to get worse. And being that the government clinics and hospitals are the main sources of healthcare, households that are poor are usually unable to access these services. There's an HIV stigma, which I have abbreviated as HA stigma. This causes a major barrier to accessing prevention, care, and treatment services. The isolation that comes with this stigma prevents people from gaining access to social and support mechanisms. And there's also a social rejection and alienation, which can compromise things like employment, housing, schooling, and childcare as well. The financial burden of HIV and AIDS-related illness or death, this falls in terms of the cost of treatment that places a very high strain on savings, and affected families cannot opt for drug therapy or even most of the basic remedies that are available in the country. Most people end up losing their medical and insurance benefits, and this is because they end up losing employment because of some of the things that are associated with that, like stigma. And once they lose this, then the treatment costs skyrocket, and some of them don't even have transportation to get to places where they can get any treatment. There is also an issue of psychological stress, which the prospect of illness or the prospect of death in the family is as traumatic for children as it is for the adults. And when death occurs, high levels of grief enters the household and communities, and there are implications related to mental and physical health, as well as social and work relationships. Children who are really traumatized by watching their parents die are not able to talk about it, and stress and depression compromise the function and well-being of all areas of a family, which include like school. When kids go to school, they cannot perform well. People going to work, they cannot perform well at work. Family relationships are impacted, and even the capacity for childcare, especially when the women are the ones who are infected with HIV/AIDS. Some of the responses to this stress lead to high alcohol and drug abuse, and some people just get into rampant unsafe sexual behavior. So the feminist theory, which stresses women's conditions, needs, and opportunities, and focuses on the empowerment of women and raising consciousness, developing personal awareness, and understanding cultural, economic, and social conditions that mold a women's reality, come into play in this situation. So there is the condition of women, where women are strongly affected by HIV/AIDS, and they are at greater risk of infection and more vulnerable to the socioeconomic effects of HIV/AIDS. Women-headed households are poorer than those who are headed by men and have fewer reserves. Unemployment is also generally higher in women than in men, And even those who are married may be consistently subject to mistreatment and maltreatment as well, without being able to resist this for economic reasons. In relations to poverty as well, women sometimes form sexual relationships to ensure food and maintenance for themselves and their families. And in many societies, like the ones in South Africa, men will usually provide women with desired goods in return for sexual favors, and sex may be traded for jobs, permits, promotions in the employment sphere, and also some men actually pay for the women's educational fees and trade that off for sex. So because of this becomes unsafe sex, and most women, they'll end up losing their economic support if they insist on safer sex from men. Violence is also another situation, and in many instances, women's sexual subordination is confirmed in and by violence. Studies in South Africa, for example, have found violence to be really big, and women have actually come to accept that violent sexual behavior as normal. And the other thing is that women also face a risk of abandonment and abuse, and because they traditionally provide care for the terminally ill, sometimes girls are even withdrawn from school so that they can take care of the people who are sick in the home, whether it be their fathers or their brothers or other male relatives. So some of the strategies that can help address HIV/AIDS would be HIV control programs, which are interventions that help change sexual behavior, like reducing the number of partners and even promoting condom use. Community outreach programs, which promote needle exchange programs, could help in addressing HIV. Female-controlled methods such as female condoms and microbicides are another way that can help deal with HIV/AIDS. In terms of the empowerment theory, which the individual rights and autonomy that the individual rights of autonomy that people/women have over themselves, including the rights to equality and freedom from any form of discrimination, the right to life, and rights within relationships and the family, would be pretty applicable here. So these are the rights that support and promote women's actual autonomy over herself, be it physically, mentally, or morally. And they not only relate to the decisions and choices about reproductive and sexuality, but also relate to the moral autonomy, which includes freedom from physical or emotional violence as well. And in this situation, women should be able to assert a clear and general right and have control over their person, including their sexualities, so that decisions about sex do not endanger their lives and health. These rights that relate to autonomy and equality, they can also help overcome some of the cultural and religious norms, which I'll look at a little later. And so states should also be required to address these developmental issues and empower women and men so they can move out of poverty. And once they move out of poverty, it helps in dealing with the situation of HIV/AIDS. Socioeconomic equality, which is access to education, healthcare, food security, housing, resources such as credit, ownership, and inheritance, are also big in this situation, especially when it comes to women. States should also develop and support programs among women and girls to empower them to insist on safe sex, including building peer-to-peer supports and peer norms, having group sessions that or group support systems that can help women understand empowerment issues and things that they should insist on being part of their rights. And there should be laws that should be enacted and enforced that guarantee freedom from discrimination, especially in situations where when people disclose that they have HIV/AIDS, they end up facing discrimination, and there should be laws that enforce that freedom from discrimination. And it would also help if they, some of the talks could help harmonize religious and customary law within gender equality. Removal of cultural and religious barriers that prevent women's access to resources and worsen women's poverty would be something that would also help address this epidemic. And also establishing rules for protection and regulation for home-based care, because there are no rules currently that govern that. So like I talked about before, children, especially young girls, are pulled out of school so that they can be the caregivers to family members who have HIV/AIDS. So if rules are created that help protect girls especially, this would go a really long way towards that. And also providing training and certification of caregivers so that they're actually trained and know exactly what they need to do when they're helping with the care of the infected. So some of the cultural and religious issues that bring about equality is that many cultural and social attitudes and practices undermine equality and increase women's vulnerability to HIV/AIDS. There is a practice called lobola, which is pretty much a man pays bride price or bride wealth, and once he pays this bride wealth to the woman's family, he is considered, it is considered that he owns the woman. And lobola has not only been linked to patriarchal attitudes of ownership of women, but also it increases the instances of violence, hence bringing about the vulnerability to HIV/AIDS. There is an article that was in the Human Rights Agenda that said states should ensure that traditional, historical, religious, or cultural attitudes are not used to justify violations of women's rights to equality before the law and to equal enjoyment of all covenant rights. Another thing is that many women who are living under customary or religious laws have no independent or legal right to resources through inheritance. So in these situations, widows are usually abandoned by their husband's family, especially if they're known to be HIV positive. And normally they find it very difficult to remarry or gain access to resources again. And again, in this situation in South Africa, these resources are gained through other men, so them remarrying again. So therefore, many women will face an uncertain and impoverished future, and they are pushed down further in the socioeconomic ladder, and they're more fragile because they're HIV positive, and then again, they're in poverty. So most of them will resort to either selling food or beer, or even engaging in migrant labor or sexual work to meet their needs. And another thing that is a cultural issue is the idea that condoms for the youths in South Africa, that it causes the youth to engage in early or deviant sexual behavior. And this has been a conflict between the ministers and their constituencies, between parents and teachers, between parents and students. So there's a huge conflict, and there's a big resistance by the church leaders and older teachers and traditional leaders. And this has created a conflict, and it does not help when it comes to trying to talk to the youth about engaging in safe sex. And that is the end of my presentation. Thank you.